Hi, my name's Diane Deveau. I'm the clinical nurse specialist at the NICU at New-York-Presbyterian, Morgan Stanley Children's Hospital. A clinical nurse specialist is the one who monitors the practice and education of the staff nurses in the unit. I've been here at the Children's Hospital for 25 years and about 30 years total in the newborn ICU. In our NICU, we take care of babies, and some of these babies have problems with heart disease. So not only are we specialists in NICU care, we're also specialists in cardiac care. Today I'm going to talk to you about the special effects that cardiac babies bring to a NICU. It is unusual for a NICU to recover post-op cardiacs. Most of the time they're taken care of in the pediatric ICU. However, at the Children's Hospital, we believe that neonates are not just small children, they actually have issues relating to their transition from intrauterine life now to extrauterine life. And so that we have to see them as a whole baby with special needs of respiratory disease, perhaps nutrition, and always integration into the family. Many of our families are first-time parents and may not know about cardiac disease, or actually may not even know routine care of the newborn. So in addition to other medical illnesses, and prematurity is huge, the issues of a premature baby, sometimes we have them less than 1,000 grams with cardiac disease. So not only do our nurses have to be specialists in the congenital heart lesion we're talking about, they have to be specialists in premature care. Many of our babies are born with, say, genetic syndromes, where the issues and the problems related to that may often cause more trouble than the actual cardiac lesion. And always integration of the family comes first. So how do we educate these very important caregivers? This slide shows our newest cardiac R.N.C. Her name's Maria. So that typically they come to us with years of experience and then come into our NICU. We sometimes hire new grads, but not always. So Maria happened to have 5 years experience, came to us. She spent 4 years with us learning about every possible illness and every possible condition. And maybe she took care of some of our more stable cardiacs, those who were several weeks out after surgery, maybe a baby with a PDA ligation. And she proved herself to be a hard worker, which is essential. We need energy when you do a post-op cardiac. She also proved herself to be a critical thinker. You don't want somebody on autopilot at the bedside. You want a thinker. And we need somebody cool under pressure, and somebody like her demonstrated all of these characteristics. So we took her off the assignment, gave her a month with a senior cardiac nurse. And by senior, I'm talking 30 years of experience. And this one-to-one education to learn how to take care of postoperative patients is really critical, because it's the slow way to learn, right? You take somebody off an assignment for a month, that's a big investment in their time, but we think it's the way to learn. It is also safest for the baby. You just can't have somebody try post-op cardiac care without supervision. So we take her off the assignment. She's buddied for a month. She learns everything there is to learn at the bedside safely under the watchful eye of an instructor. And then after that, she's given her own babies to take care of, but always with a senior cardiac nurse in the vicinity, so that she's really never left alone. In addition to the one-on-one clinical instruction she gets, there's always education going on at our children's hospital. And in particular, we are excellent about cardiac education because there is just so much to learn. That's why many of us stay here for so long, because every day you feel like you're there. So what is it that makes this education program so successful? And first off, you think to yourself, who do you want taking care of your baby? You want the bright nurse, you want the pleasant nurse, you want the one with tons of energy, and that's who you hire. You hire somebody who's going to add to your unit. And fortunately, being at a large teaching hospital like we are, we have our pick of nurses, so that is really great. And after you hire them, you invest tons of time educating them. And once you've done that, you had better want them to stay, because you are talking a lot of time and energy and money spent on their education. So keep them, treat them well, involve them in decision making. they are the educated practitioners at your bedside. They're your watchful eyes. So you want them to stay around. Our seniority in the NICU, at 25 years, I'm still fairly junior. We have nurses who are 30 and 35 years. And those are our mentors. Those have the institutional memory. Many of them started when the first cardiac surgeon operated. And so they've seen it all and done it all. And many of them remember the days before we had all the fancy technology. So they learn to use their clinical skills. And then when the new nurses come, they teach them. Also when the new medical staff comes, or the therapist, maybe respiratory therapy, occupational therapy, whoever comes to the bedside, they are there to educate them about this particular patient. And of course, education of the parents is really the big investment, right? They're the ones taking this baby home. So we need to make sure that we understand what's going on so we can teach the parents all about their baby. And then in return, because this is a team approach, we are hoping the parents get to a point where they say to us, I know my baby best. And that's when it's great, right? So that every morning the teams round and cardiology, neonatology round together. And I think that's huge because the cardiacs are specialists in the heart, but the neonatal team is specialist on the baby. Nurses always join the rounds. Everybody speaks, everybody listens, and everybody is respected. If the parents are there, they join too, because they need to learn, and they get to say what they would like to say back to us as well about how the baby's doing, questions they have, or questions about the medical care they're receiving. Because the team attendings rotate, you get different specialties. For example, within the cardiac team, sometimes you might get somebody who's a specialist in, say, electrophysiology, and then you get this excellent discussion about dysrhythmias and perhaps pacemakers. Or within the neonatal team, every doctor has a different research interest, so you get to hear a wide variety of things. But the nurses, because they've been well educated and because they're the ones standing there, they are the best able to talk about what's happening to that patient now, what they're seeing, what kind of changes, what may need intervention, or what maybe can be let ride. So in addition to the daily bedside teaching, which I think is the best way to reach people, that one-on-one discussion at a bedside looking at a particular baby with a particular set of issues, we also offer formal programs. Now, these are 3 examples of what the NICU has run this year. Our CME office also runs cardiac programs. Our pediatric ICU also runs programs that, of course, everybody can go to. But this is, within the NICU, how we propose to educate our nurses to take care of cardiac patients. The lavender flyer in the middle shows our 3-day core course, and we start right off the bat with a nice lecture on congenital heart disease at a basic level. Heart structure, what it is that you're looking for, who could run into trouble. We also are incorporating more sim lab. That is the way of adult learning. So within the core course, we do sim labs that include cardiac incidents, and the flyer on the left, the green one, that is a whole EKG interpretation and dysrhythmia course, and it came out of a feeling that this is where we needed more education. And what I loved about this program is we had a cardiologist speak, we had a neonatologist speak, we had 2 nurses speak, and then we also ran the sim lab as well. And I just think that it just exemplifies the integrated approach to education that we have here. The other flyer, the one in gold, a regular neonatal program, but with a 2.5-hour lecture on congenital heart disease and cardiac assessment. And it's done by a very fabulous pediatric ICU nurse who's not only an expert in cardiac assessment and care, but also gives the NICU nurses a perspective on what may come in the future, because she sees the kids after they've been readmitted, and some of our babies do go on to have multiple surgeries. So in addition to the everyday bedside teaching, which I think is hugely important, when you stand at a baby's bedside and really discuss an individual case, that's how the best learning occurs. However, there's many formal ways of learning as well. So on the slide, there's 3 educational offerings put out by the NICU this year. In addition, there's also programs from the CME office and also from the pediatric ICU staff. But the lavender flyer in the middle shows our 3-day core course, which is what everybody goes to when they come to the NICU. And you can see that right off the bat, we give you a nice lecture, sort of an introduction to cardiac care. We also start to involve you in simulations, and that's really the best adult learning, is when people get into our sim lab and do hands-on care. The flyer in yellow talks about general neonatal topics, but if you notice, there's a 2.5-hour lecture on cardiac care. And what I love about this lecture, it's being given by one of our very fabulous PICU, or pediatric ICU nurses. Not only is she an expert in bedside cardiac care, she also has a perspective on kids who have to come back, either because of complications or because the babies need repeat surgery. So she offers a unique perspective and can share with us so we can better teach the families about what may come down the road later on. The flyer in green, the EKG interpretation and dysrhythmia class was fabulous. We held it in June. We're already going to repeat it in November because the staff, both bedside nursing and the neonatal nurse practitioner staff, found it very interesting. And what I loved about this one, it's the integrated approach. We had a cardiologist speak, we had a neonatologist speak, we had 2 nurses speak, and then at the end of the day, the other NICU clinical specialist ran a sim lab focusing on what you might do when a baby has a sudden cardiac event as opposed to a respiratory event. And again, I think that's what makes it so so interesting to work here and so engaging to work here. We really do work as a team, and we all have something to contribute. In our NICU, we have very high standards for all our nurses, but especially for those who take care of our most critically ill babies. Therefore, it's our job to provide them with the education they need to provide the very best care. In return, they are valued members of a very prestigious service. Thank you.